So I'm going to talk about social media, not just Twitter, but I want to, the point of my talk, and I'm stealing my own thunder here, is going to be to show you quite how much social media has already changed the way we interact, not just with people, but with public, and the way the interaction's two-way rather than how it used to be one-way. And also to show you a little bit about Twitter and about how to use social media for education. I started doing, well, I've been on Facebook and stuff for a very long time, but just as a person rather than as a doctor. And I started doing a bit of social media about 5 years ago, and I decided that trauma care was quite badly done worldwide and nationwide, and I just start tweeting some tips of the trade and trying to improve trauma care in general, and then that kind of expanded a little bit, and I'm still doing some tweeting and on various other bits of social media. So these are the kind of social media things. You'll recognize most of the logos. Twitter there in the bottom right-hand corner. Facebook is fairly universal now. How many of you have a Facebook account? Should I say, how many don't have a Facebook account? There's a few proud waves there going, yeah, I don't have one, I don't want one. I'm not joining this. And how many have a Twitter account? So about half, yeah. I've started forgetting to invite my friends who don't have a Facebook account to parties. And some of them are really, really good friends. And I now think it's really selfish of them not to have a Facebook account, because it's so convenient to invite them to parties on Facebook. But anyway, so Twitter is used obviously more for news, etc. The G there is Google+, which is actually a really nice platform for medicine. The trouble is that nobody's on it really, apart from Google employees. WordPress is the blogging site. There are several other blogging sites available. Snapchat is what all the teenagers are on, where they send photos of each other to each other, and they disappear within seconds, so teachers don't find it. So these sites have actually changed the way we consume news, the way we interact with our friends, the way we interact professionally as well, and the way that we communicate with our patients, our colleagues, and for instance, the management of the hospital. I'm part of the management of Imperial, and the way that I get communicated with includes social media, maybe because I'm on there. So the traditional media has actually moved quite social media these days. Print journalism is not quite dead yet, but it's waning very much, especially among the younger generation who are consuming their news via things like the Huffington Post, the Guardian, and BuzzFeed there in the corner. So a few things about Twitter. This is Dave Jones, who's an anaesthetist in Wales. I think he's just about to apply for a consultant job, which will be quite exciting. Is probably the grandfather of all Twitter anaesthetists in the UK. He was big way before anybody else was, and he did this lovely slide of the anatomy of a tweet. So he's writing a bulletin article about Twitter for the RCOA News. So he's mentioned the Royal College of Anaesthetists. He's mentioned me, which is Trauma Gas Dog, mentioned somebody else, and then he's hashtagged a couple of things to bring attention to it. So the mentions are people or organizations. Hashtags is a way of collecting tweets about a certain thing. So if I'm doing an educational tweet, for instance, I will hashtag it TGDEd, which is short for Trauma Gas Doc Education. So that means that anyone who's interested in my ramblings will be able to look up the educational ones and sift them out from various rubbish tweets about X Factor and Strictly. So it becomes a way of distilling your tweets for a certain audience. Another way is for conferences such as this, where HomSim is the hashtag. So make sure if you're tweeting something to tweet HomSim in there as well. And so then there's ways people interact. Some people just interact by looking at it. Bless you. Some people interact by retweeting, so that means that they look at a tweet and they look at it and think, yeah, I agree with that, or, oh, that's interesting, my followers will be interested in that. So you retweet so that your followers see it. Favorite, which has now been changed into likes, I'm not quite sure I like that, but I quite miss the star of the favorite. So the favorites are a way of collecting tweets that you think are important, and other people can search through your favorites as well. So that's Twitter. How do we use it? I'm going to start with a bit of collaboration and how we can collaborate with people. This is a massive social network, and if you follow the right people, it's actually very easy to pick out people that you wouldn't run into on a day-to-day basis who have similar interests. So collaborating with other people of the same discipline. So I do upper GI anesthesia, and we've got a collaboration group which we called OG Skill with a Q, or Squill. And that's a way of collecting good practice from not only around the region, but actually around the country. And if we get orogastric surgery quality improvement liaison thing. I didn't come up with a name. So that's a way of collecting interested parties, giving them information about certain things. Google Plus is actually really good for this because you can do things in a closed group much better on Google Plus than you can on Twitter. Twitter is very, very open. Protected accounts generally get ignored by most people, and it's a way of people basically treating Twitter like Facebook, in my mind. So collaborating with people, sharing knowledge, and I think you've heard this name before, which is SMAC. So social media and critical care. I went to the last SMAC conference, which was in Chicago, lovely city actually, in June. SMAC was based, it started in Australia, and it was based on social media, and it is changing the way conferences are done. And social media is becoming absolutely integral to every single conference that happens. You're able to follow the conference from afar. You're able to interact with the conference from afar. And you can do that with most other conferences as well now. But SMAC took this to another level. One thing that was utterly delightful was having questions taken via Twitter. So the person at the back reaching the microphone, dominating it for 5 minutes, talking about their experience and not actually answering a question at all, becomes a thing of the past because you're restricted to 140 characters and the discretion of the moderator. So it was a lovely way of doing the questions. You do need a very reliable and a fast Wi-Fi in your conference center, but then most conference centers will have that now. So even now, if you didn't go to SMAC and you want to, well, one of the problems is that there were so many tweets from the SMAC conference that it's quite difficult to wade through them. But if you want to look through it, you can still get the whole conference experience from the Twitter feed and from the various social media outlets for it. Another way of sharing knowledge is through your group on Twitter. So this is Dave Jones again. Came up a couple of years ago with a thing on the glycocalyx, and I'd just heard of the glycocalyx then. And so we end up with a little discussion, and then you have a load of other people coming in, and you get instant peer review, you get instant tutorial on whatever subject you put up. It's quite an exciting way of doing it. And I have to say now, I get most of my evidence-based medicine through Twitter, and it's a much more efficient way of doing it than trawling through journals. because as long as you follow the right people and you realize that this is an open forum where anyone can say anything, including some things that are absolute rubbish. To be honest, usually if you spout something that's rubbish, you get shot down pretty quickly by everyone else who's quite sensible. Probably the reason that I got invited to do this is a blog I did a couple of years ago on adverse events. So in our hospital, we had an episode of wrong site surgery about 2 years ago now, where we meant to operate on the left foot, but we ended up operating on the right foot. The lady had bilateral disease, so actually no harm was done. And that's the beauty of this case, that no harm was done, because it allows us, and when I was talking to my medical director, I was supporting one of my colleagues who was involved. I was talking to my medical director and said, do you know, this would be a really good one to write up and share very widely. And they thought, yeah, it's a really good idea. So I did. I called it wrong-footed. I went through some of the factors that caused this this serious incident, never event. I hate the term never events because they do happen. This event to happen. And I ended up getting 22,000 people looking at this account, which is quite a lot. Got retweeted by Atul Gawande and various other people. And there was a lot of discussion on it. Medical directors from around the country shared this with all of their staff, and I'm hoping that it made people more aware of the factors that were involved in getting something wrong like this. We all get something wrong. Usually it's not because we're bad people or we're negligent or anything like that, and there are a bunch of factors that make this happen. So I wrote it up and I shared it via Twitter and Facebook. And you reach a much, much bigger audience than if you put it in a journal, for instance. I was actually surprised how little negative backlash I got. Got a few people saying, oh, that's outrageous. And when one company in the States saying, this would never happen in our institution, yeah. That means that your safety processes are bad, because it can happen in any institution. But most people said, yep, this could have happened with us, this could have happened with us. And it was an amazing thing to see. Some of my colleagues afterwards said, oh, I don't mind your Twitter thing, but oh, you went a bit over the line with this. And actually, I think it's the most important thing that I've written, because it's so important that we don't just share these events in our own hospital, but we actually take them wider so that other people can learn, and we can learn from other people's mistakes rather than having individual organizational memories that last 5 years or so and then everyone forgets. So how do we use social media to interact? I want to put it to you that the traditional way of interacting is gone. We interact with our patients rather archaically via snail mail most of the time still. I don't know about your institution, but in our institution, our processes, they're a little bit better now than they were a couple of years ago, but patients were frequently getting their appointment through the day after the appointment was due, and so obviously didn't turn up, and then often got the, why didn't you turn up to your appointment and your appointment slip in the same bit of post, because our processes were so dreadful. We should be able to book and remind people of appointments online. There's no reason why we can't, apart from data governance. But to be honest, the governance of paper is not necessarily any more secure. The postman can look it up and read it, probably as much as a verified email address. So why aren't we using email addresses more? Why aren't we using social media more to interact with our patients? We interact with the public, we interact with the media. I'm going to come on to this a little bit later, and we interact with me, so with management. British Airways, for instance, is if you look at the British Airways timeline, you'll get a load of people complaining at them through Twitter. And they take complaints through Twitter and Facebook now just as much as they do via other means. And I think in the future, we'll be doing the same for our patients. Our patients will be live tweeting from their hospital beds. This has already happened, and it'll be much more frequent. We will have to probably provide them with some hashtags where we can collect some information about it. And because at the moment, it's probably just going into thin air and nobody from the hospital is looking at it. This man, like him or loathe him, has actually done quite a lot of interesting things on social media. And he started giving medical advice on Twitter, anonymous medical advice. He's actually done it, he's probably gone as close to the social media guidance that the GMC put out as it's possible without traversing the line. I don't think he's traversed the line at the moment, but I'm not sure. But he's certainly gone to the line and gives out general advice on social media, and not usually specific advice. Another thing which amused me a little bit was something that one of our ex-trainees tweeted. So he tweeted basically at his management. They'd removed the milk from the coffee rooms in theatres, which personally I think is a really short-sighted thing because we end up losing much more in terms of time and goodwill from our staff than we gain from removing the milk. And so he tweeted that the milk was gone. You know, what are we supposed to do? We have to get changed, go downstairs, get a coffee, blah, blah, blah. How much lost time there is there. That got retweeted quite a lot, and he ended up being dragged into his clinical director saying, why are you putting this on social media? Actually, I don't think we can do that, and I think our trainees and our staff are allowed to complain about what we do on social media. I'd be a bit annoyed if they complained about it without coming to me first. And I'd quite like to know before you put it on social media. But if you're not getting anywhere with your management and they just go tough, then it's probably the next thing to do. That's what happens in most other organizations now. Customers complain on social media and say, British Airways, you lost my luggage, you're awful. And I think we're going to be next. So the medical organizations are pretty much all on social media now. The Royal College of Anaesthetists was slightly slow off the mark, but it is catching up nicely now. I think the AAGBI and the BMA are probably the forerunners about the way they use social media from our point of view. The AAGBI, for a small organization like that, actually does it really well and is quite controversial in some of the things they say, and they've actually been very supportive of the junior doctors dispute. Hospitals such as Imperial have their social media account. They don't do anything terribly exciting with it, but it's kind of bland. But it's very an important way of reaching your patients and your staff, and actually will probably become a way of your staff and your patients reaching you to complain, to ask about things, to get information about certain things, and get patient-specific advice. I think there is so much that we can do in that. So from a trust point of view, trust interacting with their patients, that's still very unexplored. And I think there's a large amount that we can do to make the trust more responsive to their patients through that. I want to spend a couple of minutes on campaigning. I think the way the junior doctors dispute happened is thanks to social media. Thanks to, or the fault of, I don't know. I think thanks to. If the junior doctor dispute had happened 10 years ago with a government that had the Murdoch press in their back pocket, like they do, then there would have been wiped out, I think. But most doctors are reasonably well socially connected. Most junior doctors will have a Facebook account. Many will have a Twitter account. Most of them will have about 500 friends on Facebook, so you get a load of people with 500 friends, and actually most of the population gets covered in some way, and you'll get through to most of the social media savvy population very, very quickly and very easily. So the march was incredible. I was there, as you can see, and it was great fun. It was an amazing atmosphere, and all the doctors were terribly well behaved. There was no litter afterwards in the streets, and the street sweepers had nothing to do, which I'm actually very pleased about. So it works both ways, though. You've got the health secretary grandstanding and tweeting stuff, and when the strike was called off, he put a tweet there. But this is my point about the two-way nature of the communication. So he puts this up. Immediately, he gets a load of people underneath him. So when you click on that tweet, if it just appears on your timeline, you don't see any of this. But if you click on the tweet, you see all the interaction below. So you'll see all the people saying, really, how can you say that? And protesting against him. So even somebody who's just following Jeremy Hunt will actually get some of the backlash as well, not just his biased view. And I think that is very interesting, and it's an amazing way for the underdog to fight against the machine, I suppose, and against the traditional media and the Murdoch press. So obviously I'm going to say that I think social media is quite a good thing. Be a little bit careful with what you put up. So the GMC added a social media section to their good medical practice, most of which was really, really sensible. The only thing I disagree with was the fact that we should identify ourselves. If we're saying we're doctors, we should identify ourselves. I started my Twitter account as an anonymous thing because I think I can protect patient confidentiality better by being anonymous and still be able to do the educational tweeting that I would have done otherwise. I, in inverted commas, came out when the social media guidance appeared. And although it's been absolutely fine, I don't really tweet anything terribly controversial. Think of if I was, let's say if I was an abortion doctor and in family planning, then I could be identified through this and firebombed and my house kind of set alight and things. And I think it risks us, and I think we should have a right to anonymity. The GMC did water down their guidance a little bit in their clarifications. So I think now if an abortion doctor went on Twitter anonymously, I don't think anyone would complain about it. So successful tweeting, final slide, or next to final slide. Being whingy and moany really doesn't help. Being a troll doesn't help either. And please be inclusive, please be positive. Tweet in good English. I hate all that text speak. And really, if you can't get your point across in 140 characters in decent English, then you need to change your point and think about a way of it scanning nicely. Because the weird tweets with U's and TXT and various other things, and B rather than BE, it's difficult to read, and if you're scanning through a timeline, then actually you're not going to read it so well. And now, when I'm scanning through a timeline, I don't really read those, and I have to concentrate on actually seeing what they are. Whereas if you wrote your point in decent English, then people would be able to scan it very quickly, get your point very quickly. Having a load of tweets that don't work without the other tweets doesn't really work so well, because Twitter is a single soundbite kind of thing that you don't normally get a whole thought process. Blogs are better for that, and then tweeting a link to your blog works quite well. So try and make each tweet a standalone entity that will get your point across without the context of your other tweets. And also, if you say something controversial, then you don't have to say, yeah, but in context it was this, 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 and this. So it's less likely to be misinterpreted. Use some hashtags to collect your tweets up, but don't make half your tweet the hashtag. If you're setting up a conference or something like that, make your hashtag short so that we've got a chance of getting our point across in less than 140 characters. Don't dominate people's timelines. Don't retweet every single thing that you see so that somebody who's following you, all they see is your retweets. It gets quite tiresome. And be a real person. By that, I mean, don't be two-dimensional. Don't just do one thing. People interact much better with somebody who puts a little bit of personal information in and has a few opinions and isn't just an organization. Finally, this quote came from Ellen Roddy last night. Whatever you share, people remember, even if they didn't comment at the time, and use it to build a picture of you. So make sure that anything that you put up, you would be happy for somebody to plaster on your front door. If you wouldn't be happy for them to plaster it all over your front door, which I'm quite happy to say that I rather like wine, and that is my front door somewhere in the background, then don't put it on Twitter. By all means, do it in a private message, but remember, anything that you say on social media, even if it's in a private message, you can screenshot it and it can be published by others. So be proud of what you write. Write about stuff that you are, and remember to be positive, inclusive, and make it a nice experience. Thank you.